I'm Alex Allaire. I'm a perinatologist or maternal-fetal medicine specialist at Northeast Georgia Medical Center, and my office practices Gainesville Perinatal Center. I've been a perinatologist since 2000 when I graduated from a fellowship program in maternal-fetal medicine at the University of North Carolina. Perinatologists are a branch of obstetrics and gynecology, a subspecialty of that, where we concentrate on women that are pregnant women who are at high risk for pregnancy complications, either complications in themselves or the fetus. Complications that a woman might have that she might need to see a perinatologist would be medical complications in pregnancies such as diabetes, high blood pressure, clotting disorders. Also, we specialize in prenatal diagnosis and treatment for fetuses at risk for having birth defects or medical problems. Most perinatologists play a consultative role and don't take over the prenatal care that the obstetricians and the midwives are providing. They would refer people to us for sometimes just a one-time visit or to co-manage through the pregnancy for women with the increased risk that we discussed previously. I usually am not in attendance at delivery because the delivery itself, most women prefer to be delivered by their midwife or doctor who they would have a more long-standing relationship with. I've moved to Gainesville in 2004 and have been practicing at the Northeast Georgia Medical Center since then. I became interested in perinatology during my residency in OBGYN because I was surprised to learn how much can be diagnosed prenatally and potentially be treated in the fetus, which improves their outcome once they are born. The thing I like best about it is I most often can give very worried couples, who are concerned about the welfare of the mother or the baby, most often good news and reassurance that with proper care and surveillance that we would expect them to have a normal, healthy baby. So very often I get a scared, confused couple in my office who leave very reassured that with proper management that they are expected to have a happy, healthy baby. I interact mostly with the labor and delivery staff and the staff at the high-risk pregnancy unit. I think the unique thing is we manage medical complications in pregnancy with nurses that are very comfortable with pregnancy, where they may be the delivering nurse and they may help take care of a woman prenatally if the fetus or the woman are having medical complications. And so very often they can continue the spectrum of having the same nurse care for them when they might be having problems in the pregnancy and the nurse who's skilled to help them through labor and delivery as well. What's unique about the way I practice compared to most perinatologists is that I like to reassure patients that although they're at risk for problems, that does not mean there are going to be problems, and we can, in most cases, reassure people and have healthy moms and babies when all is done.